Hey, what's happening, coaches, athletes? Michael Hughes here, co-founder of Gymnazo EDU, and super pumped to talk about the knee joint and all that goes with it. Now, this is commonly known as a problematic joint that really just bends forward and backwards, or it has a little flexion extension to it, but it's really much more capable than what we give it credit for. But it still has this follow along kind of mentality. It really takes direct orders from the ankle, foot, and from the hip. And though I'd love to do a 1 hour long video on this topic, trust me, I would. I'm just going to do an initial deep dive on the anatomy of the knee, how they all come together, all these muscles on the same side, how they control 3D movement. I'll dive into that, the biomechanics of it all, and then some common dysfunctions that are associated with the knee that as a coach or as an athlete you've probably seen or experienced yourself. Now, clients of mine, people I've heard, they really say, gosh, my knee hurts here, hurts here. And while that's helpful to get that information as a coach or to give it as an athlete to someone who can help you out, it's really not that important. Many of us want to put a name to a dysfunction. Well, I have a meniscus tear, and that's why my knee hurts. Or, well, I blew my ACL out 20 years ago, and that's why my knee hurts. And that's really not why the knee hurts. It's a result of pain, but it's not why it hurts. You're talking about the symptom versus where the problem came from. So I hope you're able to understand a little bit more where problems come from just after this video, especially at the very end when I dive into those common dysfunctions. And if this is already piquing your interest, and if you're already liking what I'm having to say, please hit the like button. Consider subscribing to the channel, for we love to break down the human body and how its application to training and conditioning, and really how it's useful for the trainer and for the athlete alike. And if you also want to dive in really serious and get to understanding how the knee works with the rest of the body, then please check out our multidimensional movement coaching mentorship. Check out the link in the description below, because this is a deep dive course. It's not just really a course, it's actually a mentorship. It's a partnership. It's about transforming how you think and apply the body as a coach, as an athlete, and what it means to your business and to your practice. Not only is there over 140 something videos and growing as we learn more, we apply more to it. It's a deep dive of applying how we train and condition and make it fit into your business and practice. And we especially have a lot of coaching calls that are built into the course that make this not just information, but a transformational process. And so many of our coaches going through it have changed so much of their lives. So if you really like this content and like what we're talking about, check it out. The MDMC program is a game changer, and it's a big, big deal that we want you to benefit from. All right, let's break down the anatomy of the knee. Let's start with the joint. What kind of joint is it? Well, it's a hinge joint. It really likes to flex and it likes to extend. This is the motion that it's primarily known for. But the lateral motion of the knee joint and the rotational capacity of the knee joint also should be understood, because we cannot forget about those other two planes of motion, especially the frontal plane. It has a lot more motion than the transverse plane, but it can only really get it when the foot's connected to the ground. So if my foot's connected to the ground, I can get that stickiness of my foot. As I drive my pelvis to the inside, I get that knee going through abduction or abduction, or essentially that valgusing of the knee. And the knee's designed to do that extremely well, just not too much without the proper training on how to slow it down from going there and the proper training on how to bring it back home before something bad happens. And of course, it's the same thing happens on the other way. Not as much though. We don't have as much what we call same side lateral motion as we do when we have opposite side lateral motion of that knee. But we have to understand that it should be trained in that spectrum of health and produce as much range of motion as we can effectively, efficiently, so when we do go to those patterns and we don't expect it, we know what to do about it. And that's the same thing about the rotational aspect of the knee. If the ankle, foot, and the hip rotate extremely well, that knee can rotate extremely well. But it's an in-sync rotation for the tibia and fibula and the femur. They move together in space. The knee has a little bit of capacity, a few degrees of rotation to rotate out of sync. That means the tib and fib goes one way and the femur goes the opposite way. It can only do it a little bit, but we still have to be mindful of that if we don't train this hip and that foot ankle then that knee's going to have a big problem. The knee likes to assist in motion. That's how I like to look at it. They're that basketball player that just loves to pass it off and have the other joint score the point. In fact, it's really, really good at that. So we have to have that understanding when we're thinking about training and helping the knee joint perform its best tasks. So again, it's an assister more than anything else. Now, the major muscles of the knee joint, well, let's look at it. We have the calf complex. We'll talk about primarily the soleus and the gastroc. We have the quads right up on top. We're going to have the hamstrings in back. We have the adductors on the inside, and then we have the posterior hip complex. We're talking about the different glutes, the TFL, the IT band, those connective tissues on the back side and the lateral side. Now, those are big, big muscles. There are certainly a lot more muscles that influence the knee on the upper side of the pelvis, but again, this is just an initial deep dive to get your palate going a little bit. Now, how do these muscles affect and move the knee? Well, we're going to talk about it, how gravity tells us it does it first, not how the textbook tells us. Because the textbook was written more than likely with a cadaver, a dead person, on a table. And they said, well, what does this muscle do? Well, that's this muscle, pull this muscle, and it moves the knee joint this way. That's not what gravity says. Gravity says a different story. I'm going to dive into that pretty heavily because it's about deceleration first, or eccentric loading first, then acceleration. And this is really a mindset shift. You know, I was taught heavily in my kinesiology background about what the knee does on the muscles around it and from an acceleration standpoint, but not very well from how it goes through a deceleration pattern first and the biomechanics that are associated with that. It's the same concept. If I want to shoot an arrow, right? Bow and arrow, archery, I want to shoot an arrow. What do I have to do first? Well, first I got to pull it up, right? But I have to pull the bow back. I have to make basically a backwards motion to create a forwards energy. Okay, same can be said with this one. Stand up for me if you're sitting down. Try this out literally. I want you to try to jump without putting any sort of downward motion first. That means you cannot dorsiflex the knee or the ankle. You cannot flex the knee. You cannot flex the hip. You cannot flex the thoracic spine at all. And it's the thing is that it can't happen. We have to create eccentric before we produce we have to produce eccentric, as before we produce the concentric. And that's super important as we dive into this context. Okay, what about mobility, stability? What does the knee joint like to have? Well, it likes to be more stable than mobile. It likes to have the sagittal plane be very, very dominant, have a little bit of frontal plane, and even a little bit less of the transverse plane. And the problems arrive in the knee joint when these hips and this ankle foot, which love to be more mobile than stable, when they lose their mobility, become too stable, lose their mobility, become too stable, and then this balance of mobility and stability gets off kilter, and the knee has to become more mobile to get the job done of this leg. Then it has to become an actor versus a reactor. It has to become the driver, the point scorer versus the assist. And that's where problems start to arise, and we'll talk about a lot about more of that later in this video. So it's really important, that concept that I just said. All right, what about the muscles? Let's go to the calf complex. Let's talk about the soleus and the gastroc. The soleus, to me, understand this one about the anatomy of the knee. The soleus is the brake pedal of the knee. It really is that muscle that lives underneath this showy, flashy muscle. It's a big muscle. It's a big, big muscle. And it really shows itself off from the inside because as the soleus, it crosses through the ankle joint and attaches right above, in a sense, above the lower leg, but below the knee. When it does its job very well, it decelerates the tibia and fibia from going too far forward. That's a big, big deal. Big deal, especially going down hills. We'll talk about that later in the video. And the gastroc is really the accelerator because it crosses not only the ankle joint back here, but also the knee joint. It really likes to do its job when the knee is much more straight, in a sense. Soleus likes to do its job more when the knee's bent. Gastroc likes to do the job more when the knee's straight, when it's under greater tension. But we cannot forget about the gastroc, and it has a bifurcation. It splits. It has two heads, and it goes from either side into the femur. So it also has rotational capacity and lateral capacity because of that split. So in training your calf, it's not just about doing vertical. It's changing the angle of that lift to affect that knee in a much greater capacity. So just write that down. Make sure you're doing that, especially for the gastroc. What about these 4 muscles up here, the quads? Ready for it? The quads do not extend the knee first. Remember I talked about gravity, right? They are responsible for decelerating knee flexion as we go through our gait pattern, as we go through our basic walking patterns in life. So we have to train them that way and understand that if they can't do that job first, how do they affect the knee joint? So it's really interesting when we start to think about all the machines, all the training and conditioning that's been built that extend the knee and work those quads, and I would say that's not what the quads do first in function. I can go into much deeper, but we'll leave it just at that. And the hamstrings is kind of a similar story. The hamstrings do not flex the knee first in function. Their primary first job is to decelerate knee flexion as we're going through walking and running and climbing. And it's kind of crazy because once the hamstrings have decelerated knee flexion and they go into a contractile state, they actually extend the knee. I'd love to see some comments on that one, on where your mind goes when I say that, because that's what function is with the hamstrings at the knee joint. But they also have this bifurcation. They split and they wrap around here and they wrap around there, and they have great control of therefore frontal plane and transverse plane. So if you're not training those hamstrings to cut and change directions through decelerating of knee flexion and causing knee extension, then we're missing out and we're going to damage or hurt the knee in the long term if we don't have that focus onto it. What about the inside here? What about those adductors? Well, they do not adduct the knee joint in function. They decelerate a abduction. They decelerate the knee going away from the body so it doesn't go too far as we move and locomote through our daily tasks. So it's important that we train them to go through the deceleration of abduction as they do everything. Because these adductors are crazy complicated muscles. They act like hamstrings, but they have the ability to rotate and externally and internally rotate. They have the ability to actually help with flexion of the hip joint. They're all over the place. Don't train them primarily to adduct the knee joint in open chain. You're going to miss out and you're going to cause some knee problems later in the future, because they really need to be very flexible and very adaptable to the function of your body in upright stance. Okay, now this big posterior hip right back here, the nice posterior and lateral hip. These guys are really responsible to decelerate hip flexion, decelerate hip adduction, to decelerate hip or femur internal rotation. That's what they're designed to do. They're designed to decelerate those things first and then flip those things on their head and boom, accelerate the opposite of them. But if you don't get that good deceleration, that good loading first, then that knee joint's going to be left out to dry. It's like, gosh, where are you? Where are you, hip? Where are you in this capacity for me to absorb gravity, ground reaction forces, momentum first? And that's where the knee gets busted up a lot, is it gets too wild, it gets too crazy. So if this posterior hip complex can't decelerate, then the knee is going to go into a crazy amount of that motion that we all are super afraid of, called knee valgusing. Who's responsible for that? Is the knee responsible for that? No, remember, it's an assister. It's an assister of these two massive joints. So let's kind of keep that focused in as we dive deeper into the common dysfunctions. And I was kind of just alluded to it right here. We call it the kind of the terrible triad. That's when the ACL tears. That's when the MCL tears. That's when the medial meniscus tears as well. And I was showing that off a little bit because that's a very common motion. Now, as I'm talking about common knee dysfunctions, I'm talking about non-impact stuff. Obviously, I can be tackled from the outside and boom, I literally have a shoulder pad coming right into my knee. That is certainly a way that you can destroy the knee. And I don't care how well trained you are, through the functional way of decelerating knee motion. Sometimes physics just wins, long story short. But we're going to talk about how you can train it from a non-contact injury, which is the most common way that people hurt their knees. No one touches them. It's just a foot on the ground. That's about it, and their body going through motion. So I got to give a lot of credit to the Grain Institute for teaching me the OSTZ, the oh shit transformational zones, as they say it. And what that basically means is that you're putting the knee into an environment that it has to respond very well to, an environment that you would say to yourself, oh shit, like, oh man, what's going to happen? I better do something right now or something bad is going to happen. And if we don't train it and condition it progressively through that pattern, then we're going to be in a bad shape. Because when you tear something, you overexpand it. You take it beyond its elastic threshold where it cannot rebound. It cannot slow it down and say, I gotcha, bring me back into a contractile state and bring it back into a good pattern. And that's where problems happen. That's where the knee can't decelerate this motion. It can't decelerate too much extension, and it can't decelerate the internal rotation factors that have it. Well, what muscles would be able to do that? How do you train that to happen? Well, you better not train the knee to do that, because the knee says, I'm just following along what this foot does. We better be able to train to decelerate pronation of that foot. We better be able to decelerate the dorsiflexion. We better be able to decelerate hip extension, hip abduction, and hip, essentially, it's going through a turn. It's kind of external rotation, but it's the internal rotation of the knee. And if we can't understand that, then we're going to put our knee into a very dangerous scenario where it says, I don't know what's going to happen. I hope you only run straight. I hope you only land with your knee over your toe. I hope you only do stuff that is primarily in the sagittal plane, because then you'll be just fine. But that doesn't happen. That's not life. That's not sport. So when these ACL, MCLs, and meniscus tears happen, it's really due to the lack of capacity here, from a general understanding. So it's a big deal, and I want you to understand that you have to put your knee into a position where the other muscle groups have to start to decelerate those fearful movements to bring it back home under control. So remember, ankle, foot, hip, that's where the knee gets in trouble when these two guys primarily don't do their job. What about this thing called runner's knee? Well, I'm running. How does that patella pain right on top affect? Well, you got to go back a little bit. What's the job of the knee on the lower half? Well, the job of the lower knee on the lower half is to decelerate flexion. What's the job of the knee on the upper half? Well, it's to decelerate hip flexion as well. Ankle dorsiflexion, hip flexion. What muscles really do that job very well? Again, from a general standpoint, the soleus and the quads. If they have too much tension and they can't put on the brake pedal appropriately, they're going to shift that relationship between the lower bones and the upper bones, and that knee and that patella is going to get some extra stress on it, and that's going to cause some problems, especially on longer runs. There's also some upper body stuff going on there too. I don't want to discount that, but that's for a deeper dive. So check out those muscles. Make sure they feel good, elastic, and flexible. What about just general knee pain walking up and down hills? Well, I like to think about this one. If I'm going downhill, I have to put more of a brake pedal mindset on, and we just talked about that, right? We just talked about what are the big brake pedals of this. Well, the primary ones we focus on, soleus, quad, posterior hip, right? Those are the guys that really slow down that pattern. And if they don't have the functionality, the health, the elasticity, then there are going to be some issues. What about walking uphill, walking upstairs? Well, the big powerhouses of walking up, right, are going to be the hamstrings, adductors, right? Of course, the posterior hip too. But if they don't have the ability to go through that eccentric loading to produce enough force to produce a concentric contraction, then they're going to move that knee joint out of whack. They're going to produce an aberrant kind of force at this femur on that knee joint that's going to cause it some shifting, and that's going to cause some discomfort because the knee doesn't like to be too mobile. It doesn't like to move too much. It likes to be nice, stacked, and in a good alignment. So things to consider. The body is very complicated, there's no question, and its ability to control movement is immense. But there are physical, there are biological, and there are behavioral factors that play into every single movement that we perform. How do you simplify it? Well, how do you understand or to reverse engineer it so to improve your athletes and perhaps your own life? Well, we have to understand the truth and the principles and to really perform how the muscles really move the joint and how the joints really move under physics and how it affects the situations that we're in. And then once we understand that in all scenarios, then we can solve for individual problems that come up versus only learning how to solve one problem. And once we understand that one problem, we kind of hope only that one problem gets presented to us as a movement practitioner or movement professional. In our multidimensional movement coaching program, our mentorship, we just teach you not what to think, but how to think. And I hope this video gives you an understanding of how to think about the body a little differently than maybe what the books tell you. I love talking about these topics, and if you've listened to this video at this point, I imagine you do as well. So please remember to like, subscribe, post a comment on what you think we should talk about next, because we like to dive into what our listeners love. And if you're a trainer and found this helpful, don't forget to check out our MDMC mentorship program in the links below. If you want to apply for that program, we'd love to chat with you and see how this can blow up your training and conditioning and make you have all the processes to make you just an outstanding, helpful individual to all those movers out there. Again, my name is Michael Hughes. I'll see you guys next time.